In this video, we will explain what alopecia is, what causes it, how it is diagnosed and treated, and how to cope with it. Alopecia is a general term for hair loss, which can affect any part of the body, including the scalp, eyebrows, eyelashes, beard, and body hair. There are different types of alopecia, such as 1. Alopecia areata, an autoimmune disorder that causes patchy hair loss. 2. Alopecia totalis, a rare form of alopecia areata that causes complete hair loss on the scalp. Alopecia universalis, another rare form of alopecia areata that causes complete hair loss on the entire body. 4. Androgenetic alopecia, also known as male or female pattern baldness, which is the most common type of hair loss caused by genetic and hormonal factors. 5. Telogen effluvium, a temporary type of hair loss that occurs due to stress, illness, medication, or other factors that disrupt the normal hair growth cycle. The exact causes of alopecia are not fully understood, but they may involve a combination of genetic, environmental, and immune system factors. Some of the possible triggers or risk factors for alopecia include 1. Family history of alopecia or other autoimmune diseases. 2. Hormonal changes, such as during pregnancy, menopause, or thyroid disorders. 3. Medical conditions such as diabetes, lupus, or scalp infections. Medications such as chemotherapy, blood thinners, or birth control pills. 5. Radiation therapy to the head. 6. Stressful events such as surgery, trauma, or loss of a loved one. 7. Certain hairstyles that pull the hair too tightly, such as braids, cornrows, or ponytails. 8. Chemical treatments that damage the hair, such as bleaching, dyeing, or perming. The main symptom of alopecia is hair loss, which can vary in severity, pattern, and duration. Some people may experience gradual thinning of the hair, while others may lose large clumps of hair suddenly. Some people may have circular or patchy bald spots, while others may have diffuse or widespread hair loss. Some people may have temporary hair loss, while others may have permanent hair loss. The diagnosis of alopecia is usually based on a physical examination of the scalp and hair, a medical and family history, and sometimes some tests such as 1. Blood tests to check for signs of infection, inflammation, or hormonal imbalances. 2. Scalp biopsy to take a small sample of skin and hair for microscopic analysis. 3. Pull test to gently pull several hairs to see how many come out. 4. Trichoscopy to use a special device to magnify and examine the hair and scalp. The treatment of alopecia depends on the type, cause, and extent of hair loss, as well as the personal preference of the patient. Some of the possible treatment options include 1. Medications such as minoxidil, finasteride, corticosteroids, or immunosuppressants to stimulate hair growth, prevent further hair loss, or suppress the immune system. Procedures such as hair transplantation, scalp reduction, or scalp micropigmentation to surgically restore or enhance the appearance of the hair. 3. Laser therapy to use low-level light to stimulate blood flow and hair growth. 4. Wigs, hairpieces, or extensions to cover the bald areas or add volume to the hair. 5. Hairstyles, makeup, or accessories to camouflage the hair loss or create a different look. The prognosis of alopecia varies depending on the type, cause, and response to treatment. Some people may see their hair grow back fully or partially, while others may not see any improvement or even experience worsening of the condition. Some people may have recurrent episodes of hair loss, while others may have stable or progressive hair loss. The emotional impact of alopecia can be significant, as hair loss can affect one's self-esteem, confidence, and social interactions. Some of the ways to cope with alopecia include 1. Seeking professional help, such as a dermatologist, a psychologist, or a counselor, to address the physical and psychological aspects of the condition. 2. Joining a support group, such as the National Alopecia Areata Foundation, to connect with other people who have alopecia and share experiences, tips, and resources. 3. Educating oneself and others about alopecia, to increase awareness, understanding, and acceptance of the condition. 4. Exploring different options for hair loss management to find what works best for one's needs, preferences, and budget. 5. Focusing on one's strengths, talents, and personality to realize that hair loss does not define one's identity or worth. Alopecia is a condition that causes hair loss, which can have various types, causes, and treatments. It can also have a significant impact on one's emotional well-being and quality of life. However, with proper care and support, alopecia can be managed and overcome. We hope you found it informative and helpful. Please subscribe to Health 360 for more videos on health topics.